I don't know how to really start this, so I'm just going to go ahead and say I'm sure everybody knows I had a pulmonary embolism August 14th, 2017. It was called a saddle embolism. It sits right in the middle of both of your lungs. Between 90 and 95% of people who have this kind of pulmonary embolism, the only symptom they have is sudden death. So, I'm very lucky I lived. Very lucky. I also had several other blood clots in both of my lungs, in the secondary and tertiary arteries in my lungs. I had clots from my calf all the way up to my thigh and my left leg. I spent a week in the CCU, which is the critical care unit, or coronary care unit, sorry, which is, I guess, like the ICU, but a little worse. The first day I was in there, my nurse told me she never gets patients that can speak to her, that are my age. I was rare. You know how that makes me feel? 30 years old, on the verge of death, and I'm being told I'm a rare patient because I can still talk. The doctor in the emergency room made sure to tell us this is more severe than what it looks like. I was still able to talk. I was still able to walk. I should have been dead. I should have died that weekend. All of my symptoms started on Saturday, August 12th, which is ironic because that's Brenda Ebinger's birthday. And I was really close to her, and I miss her dearly. It started where my left leg was killing me. I couldn't put any weight on it. I could not climb my stairs. I couldn't step on my foot. Like, I was hobbling around my house. I couldn't walk to my bathroom, which is like 10 feet from my living room, without my heart rate like skyrocketing to like 180, and I couldn't breathe. I had to use my dad's oxygen for 2 days. 30 years old, having to use oxygen just to breathe. Just to walk 10 feet to the bathroom. I waited Saturday and Sunday because I didn't want to go to the emergency room. I don't want to waste their time. I thought I was having a panic attack. A fucking panic attack. Because I have those. And I don't want to waste anybody's time. I always waste people's times. I always bother people. And I didn't want to do that. So I waited. Called my doctor on Monday. And of course they refused to see me. And said, no, go to the ER. You most likely have blood clots. So my parents and I get ready and we go to the ER, and I'm taking my time, like nothing's really wrong with me. I'm just freaking out like the idiot that I am. I'll be fine, I'll just give it a day. Get to the ER, I'm still not able to breathe, like it takes me forever to walk in. My mom, of course, wants to get me a friggin' wheelchair, and I say no. We get in there and they sign me in, and the lady's just completely rude. I wait. They take me back triage and do my blood work, and I can barely talk because I can barely breathe. After like 4 hours, my mom finally gets restless and like goes up there, and she's asking them like, what's taking so long? And they're like, oh, well, here's the orders for the ultrasound for her legs. She should have been taken back hours ago. My luck. So they finally take me back and do the ultrasound, and I'm back there for like, what felt like 40 minutes, so I knew something was wrong when they just kept spending time, like, kept going over my left leg just constantly, over and over and over. I knew something was wrong, but they kept going up to my thigh, like all the way up to my groin, and I was like, what? Like, only my calf hurts, like up to my knee. Why are you going all the way up there? What's going on? And it's funny because I told the lady, I was like, I've had myself convinced I was having a pulmonary embolism before, because when we lived in California, I had these same issues. Well, maybe I was, maybe I wasn't. I don't know. Maybe I've had blood clots before. Who knows? Sorry, it's cold. So, I do the CT scan, and the doctor comes in, and within 5 minutes, I'm being hooked up to heparin and EKGs, and they're freaking all out and trying to get the second IV in me because I was so dehydrated. They had so many issues getting IVs in me, and I just started bawling right away. I knew I was gonna die. I just knew it. I just didn't know I was gonna be that young. Or by that. I always thought I would die by my own hands. I didn't think I would die by blood clots. Such a weird way. So then he tells me he's admitting me to the hospital because it's that serious. So yeah, they wheel me up very quickly to the 5th floor. And that's how it all started. I was there for a week. On Tuesday, I had Dr. 2, who's a cardiologist, do my surgery. He went in through my groin and put wires up through the artery all the way to my lungs, and it dripped blood clotting medicine on the blood clots. I had to lay still for, I think it was like a total of like 14 to 16 hours. They say 12 hours, but the doctors never come in early in the morning, ever. Mine ended up coming in at like 10, and I was lucky. And he pulled the wires right out in there, and it was the weirdest feeling. Feeling those wires drag through your veins. Through your arteries, my bad. Just very weird. And it was like 10 feet long. I was like, how in the heck did that fit through my body? It was so weird. Oh, I gotta change my song real quick. There we go. Keep getting Moxie's hair in my mouth. Blah, blah, blah. So yeah, I just stay in there a few more days. They transferred me from the heparin drip to my normal blood thinners. Really, the hospital stay was the easiest part. They took care of everything for me. All I had to do was sit there and think. But now that I'm out, like, I have to be careful. The medicine I'm on, there's no antidote for it, so I can't accidentally cut myself, or I can't drink anymore. I just have to be very careful. So what caused it was I've been having some severe lady issues for basically my whole life. It got really bad last November. And in May, when I turned 30, I finally decided I need to try and take care of myself. So I made an appointment with a lady doctor. And he put me on birth control, scheduled a D&C, assured me that, you know, this will take care of my issues. I started the birth control in June, had the D&C in June. It just got worse. So, June and July were pretty horrible. August got even worse. August 1st, I had to go back to the doctor because I had a very large polyp that got stuck in my vaginal canal. And I had to get that removed in the office. I'm sorry for all the TMI, you guys, but, like, this is what I have been going through. And it's rough. And it just might help you guys realize, like, why I've been thinking what I've been thinking. I don't know. Yeah, he had to pull that out in the office, and it sucked. I couldn't go to work. I couldn't focus on work. Like, I would get there, I could log in, and then all I thought about was, like, bleeding. Bleeding all over my clothes, bleeding on the chair, getting up to walk to the bathroom, and just blood, just hemorrhaging. Like, I was hemorrhaging. It looked like a freaking murder scene every time I went to the bathroom. You can ask my mom. She had to help me get in the shower a couple of times because I was so weak from losing so much blood. And all the doctors just kept saying, oh, your stats are fine. Yeah, my stats were fine when I had a pulmonary embolism, too. My oxygen was fine. How? Nobody knows. So finally, somebody did some blood work that showed I was anemic. We all know how that iron infusion worked out, don't we? Yeah, well, anyway. So, the birth control is what made me get the blood clots. I am positive for factor V Leiden, which is a genetic blood clotting disorder. It runs on my mom's side of the family. Apparently, I am not the only one. One of my cousins has it, and she had a pulmonary embolism about 3 years ago as well. Lucky me. I just get the shit into the stick every time I turn around. Oh well. So yeah, I got off the birth control immediately. The doctor in the ER told me, you will not take this medicine again. I will be on blood thinners for the rest of my life. If I were ever to have kids, which I won't, I can't now anyway, they would have a 50-50 chance of getting the factor V Leiden. So I wouldn't want to do that to anybody anyway. I would not want to bring a child into this world with that chance. But you all know I don't want kids anyway. And I can't have them now anyway. My doctors have all told me it's too dangerous. And I'm trying to get a hysterectomy this year, regardless, because I've had the D&C, I've had the ablation, and nothing is working for me, and I'm just sick of living my life this way. So, December. That was an interesting month for me. To close out the year. I had a surgery on December 8th, an ablation. And I had a Marina implant. Marina implant. That was difficult to say. My doctor kind of forced me into the Marina. I'm not supposed to have any hormones. And he said he was going to put it in anyway because it's not estrogen, it's progesterone, and that should be safe. Should be. Yeah, you're not the one with factor 5 Leiden, dude. But whatever. I was willing to do a hysterectomy on blood thinners, so I'll take my chances. But it didn't work. Nothing works for me. Ever. And then I had my iron infusion on December 21st. You know that stupid question where they ask you, have you been suicidal in the last 6 months? Well, I was honest. Do not ever be honest with them. Ever. It backfires on you. They called a psychiatrist down to talk to me while I was getting my infusion. And I started having a reaction to it. And she told me, oh, calm down. You're just having a panic attack. I've had panic attacks since I was about 14, and I've never had a panic attack that has made my throat swell shut or has caused a full body rash. But I guess that's how people view me, is just a broken person who has panic attacks and lies about it. Whatever. So, finally, the nurses at the infusion center and the psychiatrist finally believed me when my mom started telling them this is not a panic attack. She passed out, like she helped me get to the bathroom and I passed out on the toilet. My mom started seeing the rash all over my body. So they finally believed me and sent me to the ER. And what do you know? It's the same doctor that diagnosed my pulmonary embolism. So you know I was scared. Because I was having a lot of the same symptoms. My back was hurting, my chest was tight, I couldn't breathe. So I got another CT scan. At least it showed my lungs were clear. So my clots are gone. Thank God. Or is it a good thing? Sometimes I think it would have been easier to just die in August. There's a lot of heartache and pain I could have avoided over the last few months. So I spent that night there. That was pointless. I could have came home and just taken Benadryl and just spent the day at home. I guess I'll never get another iron infusion. So now, I'm trying to look forward to 2018, but it's hard when every time I turn around, something just knocks me down 2 more steps. I take 1 step forward, and I get knocked 3 steps back. I am so sick of my life being this way. I just ask that all of my friends, please, when you talk to people, take their emotions into consideration, because you never know what they are personally going through. You have no clue. Be as kind to people as you can. You never know when it's gonna be the last time that you get to talk to them. You have no clue. I hope this video has helped give some insight into what I've been going through. If it's just created more questions, ask me. I need to talk to people. I have nobody out here.